This is a very awful and intimidating chart. I'm just showing it to you now because this is a broad overview of what we're going to talk about for the next couple of slides. And so we have our particular classes of drugs, so broad classes like depressants, stimulants, opiates, hallucinogens, and marijuana gets its own category, as well as some of the specific examples the textbook goes into. But on that note, we're going to start off with depressants. And these are aptly named because they depress or decrease our central nervous system. So sometimes they're associated with being sedative or hypnotic, where sedative means calming and hypnotic means sleep-inducing. In this case, one of the most common depressants you're going to know is alcohol. But they also have a category of sedative hypnotics, things like barbiturates and benzodiazepines. But mostly these are just things that are calming or slowing down your nervous system. Alcohol is probably the depressant that each of us is most familiar with, because alcohol is one of the most widely used recreational drugs in most countries. In Canada, the majority of adults drink every once in a while, reporting that they've drank at least in the past year, and about 24% meet the criteria of being heavy drinkers. And this is a little bit biased towards men more than women, where about 28% of men classify as heavy drinkers and 19% of women classify as heavy drinkers. But still, that's quite a few people, quite a large portion of our population that drink fairly frequently. This is especially concerning when we start thinking about alcohol withdrawal, and it's actually one of the very few types of withdrawal that can be fatal, which starts to make sense as we start talking about how alcohol actually affects our bodies. So we've already seen in the textbook that alcohol increases GABA activity, and GABA is a major inhibitory neurotransmitter activity in our brains. But alcohol also decreases glutamate activity, and glutamate is an excitatory neurotransmitter. So by increasing the function of an inhibitory neurotransmitter and decreasing the function of an excitatory neurotransmitter, alcohol is decreasing our brain activity in two very important ways. So a lot of alcohol causes dramatic drops in brain activity. But that kind of make you think, if alcohol is a depressant and it's reducing this brain activity, why do a lot of people end up feeling livelier and more energetic when they drink? And that's mostly because alcohol consumption seems to affect us in two stages. So at first, when you're having sort of small doses or when you've just started drinking, people report feelings of relaxation, elevated mood, lowered inhibitions, and you start seeing some impairment of judgment. And this is happening because our cerebral cortex is the part of the brain that slows down first. And the cerebral cortex houses a lot of our inhibitory control centers. So as those areas slow down, as they function less, we become less inhibited. That's why a lot of people, when they start drinking, are going to exhibit short-sighted behavior. It's that lowered inhibitions. So you start seeing them behave a little bit more riskily, things like drinking and driving or having unprotected sex. In higher doses, other parts of the brain start to slow down as well. And that's when we start seeing those more depressing effects, where we're seeing reduced activity. So at first, we're seeing an increase in activity, mostly just because we've reduced our inhibitions. But as we get into higher doses, as we've consumed more alcohol, more parts of our brain start slowing down, more areas have reduced activity, and we start seeing more of those depressant type effects. And so in those lower doses, we're looking at blood alcohol content levels of 0.05 to 0.10. This is about when you start becoming legally drunk, and then beyond that, you start seeing more of those sedating and depressant effects. So more brain centers are becoming depressed, your thinking is slower, your concentration is impaired because you can't focus on multiple things at once. Walking becomes difficult and your muscular coordination becomes poor. It's hard for your brain to control all of those activities all at once because your brain's not operating at full capacity. Now, I mentioned blood alcohol content, or sometimes you'll see it as blood alcohol level very briefly. And that's just a measure of how much alcohol is in your system. And that degree of intoxication or how much alcohol we have in our system can differ depending on a lot of factors. We can have things like tolerance, where someone who's been drinking fairly heavily for a long time, those compensatory responses within their body make it so that one or two drinks doesn't really affect them that much. People with larger body mass, then it's less alcohol per volume of body, so it's less intense. The concentration is lower. But even our sex, whether you're male or female, can affect your absorption of alcohol. So women tend to absorb alcohol faster than men, which leads them to have a higher blood alcohol content when you control for everything else. So this graph here from the textbook is looking at number of drinks that an individual has had. So sort of a standardized 1 shot, 2, 3, 4, 5, and then their blood alcohol level or concentration. And we can look at sort of the blue line and the yellow line. So the top one here and the second one down are for a woman and a man of the same weight or the same body mass. And the woman's blood alcohol level is higher than the equivalent weighted man at all levels. So it's just showing us that women are absorbing more alcohol more quickly, so it's entering into their bloodstream and affecting them more quickly. And lots of studies have looked at this. This is sort of a simplified view to show us that if we hold weight constant, we start seeing differences between the sexes, but people have looked at this from lots of different angles. The rest of our depressants that we're going to talk about fall under the category of sedatives and hypnotics. And these are often used to treat acute anxiety and insomnia. And a lot of these are going to act in a very similar way to the way alcohol does because they increase the activity of GABA. So they're increasing the activity of an inhibitory neurotransmitter. One of the biggest problems with sedatives and hypnotics is that people build up extreme tolerances to lots of these substances. And in order to achieve the same effect as when they started taking it, they have to take really large amounts. So if someone was taking sleeping pills, after a couple of months of being very reliant on these sleeping pills, they may have to take, a dozen, 2 dozen, up to 50 different sleeping pills to try and get that same effect. So they build up a very quick tolerance to these things. And a lot of them don't realize that they're dependent on the substances until they try and stop. And this is another one where, just like with alcohol, it can be harmful to go through withdrawal for these other types of depressants. So if you stop all at once, it can be detrimental to your health. So a lot of people have to ease off them. So gradually wean yourself off of these drugs in order to not suffer those severe consequences. And if you take very high doses of these sedatives and hypnotics, you get more extreme effects of those depressant effects. So if it's too intense, it could lead to unconsciousness or even coma or death because your brain activity can be depressed or decreased so much that it becomes detrimental to your survival. And because these are operating in a very similar way to alcohol, using these drugs while drinking can increase the risk of overdose because they're both increasing the activity of GABA, which can lead to unconsciousness, coma, and death. So stimulants are going to rev up or stimulate and increase our central nervous system. So they're the opposite of the depressants. So things like nicotine, cocaine, and amphetamines are all going to increase activity within our central nervous systems. This increase in central nervous system can lead to an decrease in blood pressure, respiration, heart rate, even overall alertness, which might be appealing for some people, especially that alertness. A lot of people choose to use stimulants because they can boost mood. Sometimes they even produce euphoria, that really, really good feeling. But they also have their downsides and can increase things like irritability and, extreme cases of high blood pressure or increased respiration and heart rate can also be detrimental to your health. Probably the most commonly used stimulant would be nicotine, what you can find in cigarettes. And nicotine tends to activate receptors that are sensitive to acetylcholine, another neurotransmitter. People who use nicotine regularly say that it helps them feel stimulated or relaxed and alert. And interestingly, nicotine has what's called an adjustive value, where it seems to enhance positive emotional reactions and minimize negative emotional reactions. So it boosts the positive and mitigates the negative, which makes it fairly appealing for a lot of people. So some of these effects are part of what makes nicotine so appealing and so addictive for people who are using it. For stimulants that pack a little bit more kick, we can talk about cocaine. And cocaine is the most powerful of the natural stimulants. It has pain-blocking properties that once made it widely used for local anesthetic for people undergoing eye, nose, or throat surgery. And we still use to this day a derivation or a synthetic version of cocaine called Novocaine, and they use it for dentistry anesthetics, so it's still commonly used today. But cocaine blocks the reuptake of norepinephrine and dopamine, which basically means that it leaves those two neurotransmitters active in the synaptic space or attached to those postsynaptic receptors. So by not reuptaking, by not collecting those neurotransmitters from the gaps between our synapses, they're going to continually produce signals. They're continually going to be affecting the postsynaptic neuron. And this can lead to people experiencing prolonged feelings of euphoria, enhanced mental and physical capacity, stimulation. They experience a decrease in hunger, indifference to pain, and an overall sense of well-being while not feeling tired. So all of these things make it seem pretty great. And all of these stimulating effects led to its use in health tonics in the past. As you've probably heard, Coca-Cola was originally made by mixing cocaine and a bunch of other flavors to produce a beverage. But considering the fact that cocaine is illegal, I'm sure you can imagine that there are tons of negative side effects as well, which usually comes along with messing with those neurotransmitters. So if you overuse with cocaine, you end up with fever or vomiting, convulsions, hallucinations, or even delusions. And there are massive crashes after the cocaine wears off. So after a cocaine high, people can start having severe depressive crashes. So they feel awful because they're no longer feeling good from the drug. So lots of negative side effects associated with this one. For our next broad category, we have opiates. And opiates are sometimes called narcotics, and these are a major problem in terms of drug addiction. And that's because they relieve pain and help people sleep. So an absence of pain is a very psychologically appealing process for a lot of people. But if we think about how tolerance and withdrawal works, if you're on opiates for a long time and then stop, those compensatory responses would actually cause you to experience more pain than normal when you stop, which is why there is a major problem with opiate addiction. And a couple of the common ones would be heroin and morphine and codeine. Some of these which are widely used in hospitals. For a long time, heroin has been one of the most commonly used opiates, But in recent years, we've seen a rise in things like oxycodone and fentanyl. All three of them tend to produce senses of euphoria, that really, really good feeling, that intense feeling of goodness, and again, providing pain relief, both of which tend to be fairly appealing. Because they're affecting the activity of dopamine, again, another neurotransmitter associated with feeling good, and also tending to stimulate areas that are activated by endorphins. They can do a lot of different and weird things to our brains. So there's the pain relieving, the feeling good, changing of mood, but also playing with other areas of the brain, mostly because endorphin receptors are found throughout our brains in lots of different areas. So we can start seeing opiates affect things like body temperature or even hormone levels. Strangely enough, heroin was originally marketed as a cough suppressant because it affects the part of the brain that influences whether or not we cough in response to a stimulation. So early forms of cough medicine, early forms of cough suppressants contained heroin because it stopped us from coughing. So a little bit extreme now that we know the effects of heroin. People can experience that feeling, that pleasurable rush for a very short period after they've taken a dose, and then they crash. They almost pay the price for feeling that good for that short period of time, where their body uses up a lot of their resources. So maybe burns through a lot of dopamine or just takes its toll on their physical self. So our second to last category is the hallucinogens. And hallucinogenic or psychedelic, that they're named that because they're going to produce dramatic alteration in your perception and mood and thinking. So hallucinogenic because they cause hallucinations. So things like LSD, mescaline, PCP, ecstasy, all altering your perception and maybe also your consciousness. So some people will group marijuana in with the hallucinogens, but not all people. And our textbook opted to keep marijuana separate in its own category, so that's the next one we talk about. But I just want to mention, while we're here talking about hallucinogens, that sometimes marijuana gets lumped in here as well. And unlike some of the other drug categories that we've talked about, where each individual type of drug within that category will have a different mechanism to act, within the hallucinogens, they all seem to interfere with serotonin. And they're all operating at the level of the synapses between the neurons, mostly in the brain. And our hallucinogens tend to be very, very active in the parts of our brain that have lots of receptors for dopamine. So that could be how they're producing these dramatic shifts in our perceptions and our consciousness. And that's mostly what people are taking hallucinogens for, is for that hallucination and altered consciousness state. But if it goes wrong, some people can go the other way and it can produce panic or paranoid delusions, confusion, depression, discomfort in your own body. And if you're remembering when we talked about neurotransmitters, that might be kind of familiar because dopamine was linked to things like schizophrenia. So altering dopamine levels can cause symptoms somewhat similar to that. So it's a delicate balancing act, and people are never sure which way their experience will go. And then for our last category, we have marijuana. And interestingly, our textbook was originally written when marijuana was illegal. So it was listed as the most frequently used illegal drug in Canada, though that's not actually the case anymore since it's been legalized. So the effects of marijuana are due to THC, at least the drug-like effects that we tend to use for. Users report short-term effects, so it's not really a long-term, long-acting thing. People feel like time is slowing down. They have enhanced feelings of touch, increased appreciation for sound. They might be hungry or feel really content or happy. So all of these could also be taken as alterations of consciousness, which kind of go along with what we just talked about with our hallucinogens, which is why some people like to categorize marijuana that way. But a lot of these effects don't perfectly fall in with the hallucinogens, which is why it gets to go on its own. And especially now that it's been legalized, people are very concerned about what happens for long-term users. What are the long-term effects? And there's some evidence that there could be an alteration to memory and attention where it impairs memory and attention. But there hasn't really been a lot of evidence showing that there's anything overall physically bad, though it does depend on method of use. And there's so much research on all of that sort of stuff that if you're interested, you can look it up, and there's even more in the textbook as well. But in order to finish this chapter, I'm going to keep on into a sort of out of place section on awareness and attention. And this is here because I believe we covered, or the textbook covers attention a little bit earlier, and I completely missed it somehow. So I figured, since we're talking about consciousness, and consciousness deals a lot with awareness and attention, we might as well talk about this here before we get too much further. So if you're following along with the textbook, you might have to go hunting for where this is because it doesn't follow with the rest of the subjects in this chapter. So awareness is the ability to directly know and to perceive, to feel or be cognizant of events. Or if you look it up on Wikipedia, awareness is the state of being conscious of something. So again, we come into this factor of it's really difficult to define some of these terms. So awareness is being aware of things, though using the root of the word in its definition is usually frowned upon. So we can concentrate our awareness on one particular phenomenon. We can focus on something, but by directing our attention to that particular thing, we actually exclude other stimuli. So concentrating awareness and focusing attention makes us good at noticing one thing and bad at focusing on others. And so our attention can be directed and focused, but it is going to be limited, which we already kind of talked about with the idea of divided attention, where we have only a set number of resources available, and we can't focus on everything all the time. So when we're trying to direct our attention, this can be a conscious process. So you can choose to shift your attention to your phone as it buzzes, instead of listening to the lecture. You've chosen to focus on one thing over something else. But our attention can shift unconsciously too. There are some stimuli that are so attention-grabbing that we have no choice but to focus our attention. So if a fire truck rolls down your street with the sirens and lights on, that is something that is designed to grab your attention whether you want it to or not. The color, the sound, the lights, the flashing, the moving, all of it grabs our attention, and it does so unconsciously. We don't think about it, it just happens. Now, if we're trying to test attention or the limits of human attention, there are a couple of different ways we can do this, but one of the easiest to talk about and easiest to perform is using something called shadowing. And so if you can imagine a participant showing up at a lab to do a shadowing experiment, they can give you a headset, and on the right side, they're going to give you a list of, here they have birds. So they give you a list of bird names. And on the right side, they're going to give you a list of weather conditions. And we're very capable of hearing both sides. We can sort of be aware that one side is birds and the other side is weather stuff, but we're not really paying too much attention to either. Now, if the experimenters ask us to repeat what we hear on one side, we're very good at doing that. So we could repeat out loud that we heard crow and jay and robin and thrush. But if they ask us afterwards, what were we hearing on the other side? Most people have no recollection of what happened on the other side. So they wouldn't be able to repeat the words that they're hearing on both sides. We have to focus our attention to pay attention to one side or the other, but we can't attend to both. Now, I would very much like for you to pause the video and go and watch this YouTube video up on eClass right now, if you haven't watched it already. This is one of the coolest videos that I get to show for this class, and I'm very sad that I don't get to watch your faces as you watch this video, because it just makes me so happy to watch you learn things from this video. So this is one that even if you don't usually go and watch the videos, watch this one. It's really short and it's really cool. And then you can go show it to everyone you know because it's that cool. All right, so hopefully you're back from having watched that video. And now we get to talk about what's called inattention blindness or inattentional blindness. And this is the idea that stimuli that you don't focus on can still register in your nervous system, but don't enter your consciousness. So you see it, but because you're not paying attention to it, you don't know that you've seen it. And so just like in the video, where you can actively be watching the basketball players, you can count the number of passes that they made, but you didn't realize that there was something else to be seen walking through the middle of the crowd. And that can happen in so many different situations. And in terms of experiments, they've conducted experiments with radiologists, people who are specialized at looking at x-rays. And they would show them these x-rays and ask them to identify a particular structure or something like that. And the radiologists would be so focused on the task that they were given that they didn't realize that there were pictures of gorillas on the x-ray film. They could miss things that were plain as day because they were so focused on something else. They also had pilots in a testing simulator where the pilots could focus so intently on just the instruments inside the machine that they completely missed the fact that there were artificial planes on the artificial runway out the window. So they were so focused on one thing that they didn't see something else, even something that is very important and pertinent. And this brings us back to that idea of why cell phones are so dangerous while driving. Because if you're focused on something else, if you're putting all of your attention on your cell phone, then you can easily miss important other pieces of information. Now, if we want to start talking about factors that actually influence our attention, there are tons of them. So the nature of the stimulus can influence our attention. We are pre-programmed to pay attention to certain things that are new, things that are moving, things that are very intense or repetitive or that stand out, all tend to draw human attention. We also pay a lot of attention to things that have biological significance, like an attractive face, or personal significance. Maybe you see someone you know. Those are all going to draw your attention. An individual's internal state will also affect what you pay attention to. So if you are hungry, you are going to be very aware of absolutely every food-related cue that you encounter. If you're walking across campus and you're hungry, and the wind is blowing in the right direction, all you can smell is Subway and their bread. Or maybe you're waiting for the bus and there's a billboard for a hamburger stand. And that's all you can focus on because you're hungry. We can also be insensitive to things because of our internal state. If you are really tired, you might not pay any attention to external cues because you're so focused inward. We can also have an effect of personal motivation and interest, things that you are an expert in. So if you go for a walk with a friend who is a botanist, they're going to focus on the plants that they're seeing. An architect will pay attention to structures. If you ever get to go on a walk with me, I will point out birds and their particular songs, because that is my interest and that's what my brain pays attention to. Also, personal experience can shape your attention. So a friend who loves going to a haunted house is not going to be as startled as someone like me who absolutely hates them. Or if you've played a video game for a really long time, you might notice a hidden trick, a key that isn't quite in the right place or something like that because you're used to playing that game. So you shape your attention through experience. And I've already talked about some of our innate predispositions. So we are very quick to notice an attractive face. We're also very, very good at noticing angry and fearful faces because it's biologically relevant to identify a threat or maybe someone who has been threatened. So it's a good idea to find them and figure out what they are angry at or what they're afraid of. We're really good at focusing on moving stimuli, and we're especially gifted when that stimulus is coming at us. For example, baseball players will move very quickly out of the way of a pitch that could hit them, but if the ball is going to just miss them, their response time is much, much slower. So our minds can tell right off the bat if we're at risk of getting hit or not, and react accordingly. And so our last sort of tack on to this is the idea of peripheral attention. So we've kind of been talking about attention as the things that we're focusing on and presumably looking at. But our vision is also really, really good at finding things and looking at things from the side. So our peripheral vision is very specialized to evaluate things, to decide if they're worth being the center of our attention. So our vision is a lot better when we're focused on it directly, when it's focused on our fovea. But if we see something off in the corner of our eye, we're really good at telling what it is, especially if it's a natural stimulus. So if you see a tree out of the corner of your eye, your mind can very quickly dismiss it because it doesn't matter, it's not a threat. But if you see a four-legged figure out of the corner of your eye, it could draw your attention very quickly because what if it's a bear? What if it's a wolf? What if it's a threat? So we're really good at telling those natural stimuli. A lot less good at artificial stimuli, but we'll take what we can get. And if something in our peripheral vision sort of qualifies as being worthy of attention, then we can rapidly shift our full attention and our focus to that object. So even though it's off to the side, our brains can still decide if it's a threat and shift our attention accordingly.